Hi, I'm Asher. I'm one of the RVTs here at Family Pet Veterinary Center. Today, I'd like to help you feel better understanding dog vaccinations. Hi.
Asher, what vaccinations does my dog need and why are they important?
So for most dogs, we're always going to recommend our rabies vaccine, distemper parvo, leptospirosis, kennel cough or bordetella, flu, and Lyme vaccines. All dogs should be vaccinated for at least what we consider the core vaccines: rabies, distemper, lepto, and kennel cough, to protect them against viral illnesses.
Are vaccines for dogs really safe?
Vaccines for dogs are safe. They go through rigorous testing trials before being allowed to be given to dogs. There are always a risk for reactions based on different dogs, but they are in general very safe.
Are there any risks or side effects associated with dog vaccinations?
Dogs can have some reactions to vaccines. We can see hives or other facial swellings, vomiting, lethargy, things of that nature for some dogs.
At what age should my puppy receive its first vaccinations?
Puppies as young as 6 weeks old should start receiving at least their distemper parvo vaccinations.
How often will my dog need booster shots?
When they're still puppies, we recommend doing vaccines every 3 to 4 weeks, but as they get to be adults, we can usually do vaccines yearly to every few years, depending on the vaccination.
What is the difference between core and non-core vaccines?
Core vaccines are what we recommend for every dog, no matter their lifestyle, and based on general public wellness. So our rabies vaccines, distemper, leptospirosis, and bordetella are what we consider core. The non-core vaccines are more based on general lifestyle of dogs and how at risk they might be for exposure to those illnesses.
Why is a rabies vaccine important for my dog?
Rabies is a very fatal infection that animals can get. All mammals are susceptible to it, and it is a big public health risk. So the state of Iowa requires all dogs to be up to date on the vaccination.
What is the distemper vaccine and what does it protect against?
Distemper is a fatal viral infection that dogs can get and presents with respiratory, gastrointestinal, and neurologic symptoms. So the vaccine protects against that disease.
Should my dog get vaccinated for Lyme disease?
Lyme disease can be very important for pretty much all dogs. It protects against Lyme disease, which can be transmitted through tick bites. So any dog that has a exposure to ticks, especially dogs with a high exposure, so those that go camping, hiking, even go to dog parks or go on walks in wooded areas, are going to be at a higher risk of that. But even our smaller dogs that go out into the yards are still going to be at some risk of exposure, so it's never a bad idea to be vaccinated against it.
What are the symptoms of an adverse reaction to a vaccine?
So our common adverse reactions are going to be facial swelling, hives, which you can see by kind of raising of the fur in areas, vomiting, and lethargy.
Will my dog be sick after the vaccination?
Most dogs have very minimal reaction to their vaccinations. We might see a little bit of tenderness in the area that the vaccination was given, or a little bit of general sleepiness right afterwards. That should be the extent of the symptoms that they experience.
Can my dog be vaccinated if they are sick or on medication?
If a pet comes in that's not feeling well or is sick, we usually will recommend holding off on vaccinations until they're feeling better, just so we don't overwhelm their immune system while they're not feeling well. If they're on a medication, it depends on the medication, so it's best to ask your veterinary team what would be best.
What is kennel cough and should my dog be vaccinated against it?
Kennel cough or bordetella is a respiratory infection that dogs can get from being in areas where infected animals have already been. Our biggest concerns are kennel environments, hence the name kennel cough. So boarding, grooming, even daycares, but the virus can last in the environment for several hours after an infected animal has passed through. So we do recommend all animals be up to date on it.
Is the canine influenza vaccine necessary for my dog?
The flu vaccine is what we consider a non-core vaccine, so it is more dependent on a dog's individual lifestyle, but if they have frequent contact with other animals, so they do travel, they go to daycares, grooming, boarding facilities, things of that nature, we do recommend them be up to date to protect against that virus.
Can vaccinations be harmful if my dog is pregnant?
If your dog is pregnant, there are different vaccine protocols that we need to take into consideration, so you are best to ask your veterinary team what they would recommend.
Are there any dogs that shouldn't be vaccinated?
There are some dogs that may have certain health conditions where we would be more hesitant to give them certain vaccines. Again, if they have any questions on if your dog should be vaccinated based on their health conditions, you should address that with your veterinary team.
How much do dog vaccines cost?
That's going to depend based on the vaccine itself and from clinic to clinic. If you have a question, you can give our office a call and we can get you an estimate.
How can I keep track of my dog's vaccination schedule?
Our vet clinic here will send out automatic reminders for you, but we can usually bet that if they haven't been vaccinated in the last year, they probably are due for an update.
What should I do if I miss my dog's vaccination appointment?
If we need to, we can always reschedule a vaccine appointment as soon as you are available.
What should I do if I notice my dog's behavior change after vaccination?
If you notice any changes or have any concerns in your pet after vaccination, give our office a call or stop in so we can take a look and make sure everything's okay. If you have any questions or concerns on dog vaccinations, give us a call at 515-224-9747 for our West Des Moines office or 515-981-0317 for our Norwalk office. We're always here for you.